Hello, everybody. My name is Jordan Rourke. I'm a nursing student, and today I'll be presenting to you how to prepare for college with a healthcare focus from a nursing student perspective. So, topics covered today: I'm going to introduce myself and my brother. I'm going to explain how nursing has expanded and the increased opportunities available in healthcare, and how to prepare for college while in high school. I want to think about once you reach college as well. So, introduction. Hello. My name is Jordan. This is Jarrett. We are 19 years old. We are around your age. We graduated with our Associate of Science and from high school in May 2020. What's cool about us is that we went to virtual school just like you. We attended one very similar to the one you're attending. And so we understand where you're coming from. We understand your background and we understand your drive as well. And so we began our first semester of nursing school in fall 2020. We are currently in our third semester, just finishing it up. And next semester will be our last semester when we graduate. In the summer, we will take our NCLEX exam, hopefully pass on the first try, and get our RN, registered nurse license. Exciting stuff. This picture on the right I took of us during our first semester, so we progressed a long way. So first I'm going to talk about nursing opportunities and how this doesn't only apply to nursing but to a lot of healthcare careers. According to a Gallup poll that I have in the references, nursing has been the most trusted profession for the past 18 years. Nurses work hard to maintain this reputation. They have a lot of responsibilities. Nursing is one of the fastest growing professions. According to the AACN website, there's projected nursing shortage between 2016 and 2030 due to the baby boomer generation retiring and more older people needing medical help. This is one of the reasons that is causing the shortage and the increased demand. However, there are other factors I think contribute to this shortage. Although we have a shortage in the healthcare profession, the standards of healthcare and the standards for entering healthcare professions has increased dramatically over the past decades. And so not only do we have a shortage, but it's harder to get into nursing schools, medical schools, PT schools, physical therapy schools, occupational therapy schools, um, because the schools are not big enough, and because there's a shortage of teachers and professors in teaching the program. And so it's become more competitive to get into the nursing and the healthcare professions, which is unfortunate because we have a shortage, but there's a competition. And so whatever healthcare field you get into, you'll have a secure career, but it just may be hard to get into. But there's different ways to get into a healthcare career. So this shortage is based on a number of different things. Another thing I find the shortage is based off on is the increased standards of the hospitals. They're now requiring most of nurses to go back and get a bachelor's of nursing degree, whereas nurses used to only have to have an associate's. And they have been employing less and less LVNs in the hospital, giving nurses more responsibility, which has put a lot of workload on them and a lot of stress. So there's just a combination of factors on why nursing and healthcare professions are some of the most rapid growing professions. So let me move on. 50 years ago, nurses were considered more of a doctor's assistant and had less formal education understanding the human body. Now hospitals require nurses to have a higher education BSN, and they are more independent from the doctor, trusted with performing interventions independently. So we have different areas to work in as a nurse. These are just a few. There are far more. Nursing is such a wide field, and you can get into many different careers and places just by having the RN license as your foundation. Once you have your RN license, you go and get a master's in business and be a hospital administrator. You get a master's in education and be a professor. You can get a master's in nursing and be a specialized nurse, wound care nurse. or you can become a nurse practitioner or certified registered nurse anesthetist. There's so much you can do with a nursing degree. So what we have here, you can be a pediatric nurse, work with children, be an ER nurse and work with acute trauma cases, OR nursing, help and prepare the patient for surgery and take care of them while in surgery and after surgery. Geriatric nursing, taking care of our elderly, our mature population. Cardiac nurse, you can work on a telemetry unit and carefully monitor the patient's heart functions and medications. Oncology nurse, those are our cancer nurses. You can be an oncology pediatric nurse, requires I think a few more certifications, but can be rewarding. Obstetrics nurse, so as obstetrics nurse, you can be a postpartum nurse, a labor and delivery nurse, a NICU nurse, different nurses like that. And they work with the families, the mothers, the fathers, and the infants. Mental health nursing, we take care of people who cannot function in society, who cannot take care of themselves and function in society. And so that's what mental health nursing does. It helps promote the people, the patients, and helps them develop new coping skills to better function. We have a school nurse. You can be a nurse in a school taking care of maybe about 200 students. And so that can be exciting and nerve-wracking. Orthopedic nurse. So if you broke your bone, broke a bone, fracture, sprain, strain. Travel nurse. Travel nursing is exciting. You sign up for an agency and you go to different parts of the country or different parts of your state. You also be a home care nurse. You can go to the homes of your patients and check out up on them, make sure their environment's safe, make sure they're taking their medications, see how they're doing. And there are a bunch of other different nursing professions you can get into as well. You can be an ICU nurse. I didn't mention that here. Medical surgical nurse. And there's many more I can't think of, but there are so many different things you do with your RN degree. Different types of nursing, just to name a few. We have our RNs, LPNs, and LVNs. Those are our vocational nurses, licensed vocational nurses. You see them work more now in nursing homes. They used to work alongside the nurses in the hospital, but they've been moved into nursing homes, which has disappointed many LVNs. Um, we have our advanced practice registered nurses, and so these are our nurses who've gone their registered nursing degree, got their bachelor's, or have just gone their associates in nursing and moved on to get their master's. And they can become a nurse anesthetist, nurse midwives, clinical nurse specialists, and nurse practitioners. They can also be nurse professors as well. As an APRN, you have special in different areas. I like to think of a nurse practitioner as the back way door in becoming a doctor or provider in healthcare. You do have less, as a nurse practitioner, you work under the license of a doctor, but you help diagnose your patients, you prescribe medications, you assess your patients. So it can be a fulfilling field, and a just as fulfilling field as being a doctor. How do you set yourself up for success? And so I provided this map on the left, and it's just to say that your journey is a marathon and not a sprint. Your journey is not going to be straight lines. You're going to have lumps and bumps in your journey. Some parts of your journey are going to take longer or shorter time than others, and that is okay. The main thing is to have a plan in mind and keep it flexible. Taking classes that reward you in college credit in high school allow you to enter college and get the degree you want faster. Take classes in high school that will support your healthcare journey. So right now I know you guys are in a HOSA. I'm sure many of you have taken medical terminology and AP1 and AP2. Those are great classes to start with. You've probably also taken the health science class. Those are excellent classes to start with. Jared and I, we were not able to take those classes when we were in high school. We were not offered those classes. And so having a base in medical terminology in AP1, AP2 will help you understand the content you learn in college when you take AP1, AP2 in college. So definitely soak all the information in and keep the resources that you've learned from those classes with you. It is entirely possible to graduate high school with an associate's degree. And you may be thinking, how do I have enough time to do that? Well, you may not, and that's okay. Keep it flexible. Still try to earn college hours while in high school. Um, I know when we were in high school, we took advanced placement history and economics, though they were not the most fun classes. We could get college credit from that. But we were able to earn our associates when we also graduated from high school. And that was because we were homeschooled and we treated our college classes as our homeschool classes. And so it's completely possible. I would suggest, using your summer to take a few college classes, but as well. And I would highly suggest before you take any classes or plan out your degree plan to talk with an advisor. They'll be able to provide you with the most um, succinct and straightforward pathway you can do to get your degree. What can you do in high school to be successful in college? Well, there's a couple things. You can take high school and dual credit classes. Here I have listed high school and dual credit classes that will help you succeed in college. Say biology and chemistry are by far the two most important classes you can take in high school because they'll help prepare you for general biology in college and AP1, AP2, and the chemistry that you will have to take, the college chemistry. Those are the two most important classes. Algebra 1, Algebra 2, and AP or DC statistics. Statistics are be very, very important to take for a nurse because as nurses, we don't only provide care, but we research evidence-based practice models. And for us to be able to understand statistics and understand numbers that we're looking at and the significance of these numbers will help us implement new interventions on our floor that we work on based on best practice, evidence-based practice models. Medical terminology and healthcare sciences, skills for health, high school anatomy, and physiology are great classes to take during high school. English is important to take during high school and can be a dual credit class. Although nursing isn't the good thing about nursing, if you don't like math, there's not much math in nursing other than dosage calculations. However, you'll be learning how to write APA formatted papers, and so English is important to know. And again, AP or DC psychology. Psychology has a lot to do in nursing and healthcare because we're dealing with people, and we have to understand, how they're thinking and what they're thinking, based on their, developmental age, whether you're an infant, a toddler, you know, a preschool aged child or school aged child, teenager, adolescent, young adult, middle adult, older adult. We need to understand how they think. We need to understand what milestones they complete. Psychology is very important to understand, especially if you want to become a mental health nurse or want to get a mental health profession. So opportunities outside of high school, volunteering in a hospital. Um, I know with some hospitals now they require you to be vaccinated. So you had to look into policies for that. I know some hospitals are open and allowing volunteers. Some hospitals are not, based on your age. So I would look that up. But it's a good opportunity to see how staff work together. Healthcare is very much a team-based effort. Um, I'd ask your local doctor clinic whether you can shadow one of the nurses or doctors. Let's say, you've been going to your provider for, them for 10 years, you've been going to them for every year, you probably developed a good relationship with them. So I'd ask them, you're interested in healthcare, listen to their perspective. How did they get into healthcare? Ask them to ask them to tell you their story. But also ask if you can shadow a nurse or certified nurse assistant or a doctor while in the clinic. Chances are, they may say no, but they may say no, they may say yes, but if they say no, they'll probably suggest you different alternatives as well. So just ask. The best thing you can do now is ask and inquire. No question is a stupid question. If you want to know some information, you want to get the best information you can get, ask. and inquire. Another thing I noticed, some hospitals, some high schools offers a CNA. You can earn a CNA while in high school. I don't know if TOPS allows you to do that. However, there are many CNA programs around in Texas. A CNA, becoming a CNA is basically you have the same responsibilities as patient care tech, and so you're delegated roles by the nurse. So yeah, it's just whatever you can to do to be exposed to a hospital setting is going to be worth it. I will say though, if you want to get in healthcare and not work in the hospital setting, that is possible too. Just keep in mind that when you first start in healthcare, you probably are going to be working in the hospital setting for a couple months to just gain that experience. And then you can get different certifications and degrees to transfer out of the hospital, maybe to more of a clinic setting, or maybe even to more of a telehealth setting. So just keep that in mind. If you get a healthcare degree, you don't exactly have to work in the hospital either if you don't want to. So, what was our experience? So, healthcare is becoming more competitive due to an increase in demand to join the profession with a limited number of spaces in nursing colleges and universities. This is true for many healthcare professions. You want to get into nursing school or any medical school or any healthcare kind of school, any advantage you can give yourself to set yourself apart from everyone else will help you immensely. In high school, we did not take medical terminology classes, which I wish my high school offered. It would have been incredibly helpful when I was taking anatomy and physiology 1 and anatomy and physiology 2. So if you pick a nursing college, what are some things to consider? Or any college for general, you want to consider the class size. Do you work better in a larger class, or you work better in a smaller group of classes? And the class size that varies between universities versus community college. Universities like Texas Tech and Women's University have their universities, and they have a bachelor's of science in nursing programs. And their class sizes can be, you know, they can be big, but not too big, not as big as usual university classes. Whereas with a community college like Grayson College has a nursing program, or for example, Collin College, they have a nursing program, but they offer associate's degrees instead of BSNs. They have a little bit of a smaller class size. You want to know the location of the college, and this is important because do you want to get up at 6 or 5 in the morning to drive an hour and a half to your class at 8? That can be hard, and if you want to drive that long, that's okay. But the college that Jared and I go to, it takes us about 35 minutes to drive there, and so we're very thankful for that, and that's actually one of the reasons we picked the college that we go to currently. So location is very important. It depends on, you know, how far you want to drive, what community are you surrounded by, are you going to live in a dorm, what kind of opportunities are provided in that location, things like that. Location of the college is also important depending on what hospitals are surrounding it. Are these like good prestigious hospitals that you're going to want to work in? Or because these are the hospitals you're going to be making relationships with as a nurse or as a medical student, nursing student, things like that. Do you want associates versus a BSN program? More hospitals nowadays are requiring you to have your BSN degree. There's different things you can do. You can go and get your BSN degree from a university, or you can get your associates from a community college, and then go from your RN to BSN, which takes a year longer. It just depends. Jared and I, we're getting our associates first because the college we're going to is cheaper than most universities and colleges, community colleges, and it's close to our house. So that's why we decided to get associates. We're also 19 years old, so we're not in a huge rush as well. So we're getting our associates, and after we graduate with our associates, we're going to get our RN license, then immediately jump into an RN to BSN program. That should take us a year to complete. So these are just things that you need to think about. University University versus a community college. Do you want that university life? Do you want the community college life? In community college, you may have a smaller class size. University may have a slightly higher class size. So it's just things to think about. Accreditations to the college. Accreditations of a college are so important. You want to look at how the college is certified. You want to make sure that they have their CCNE accreditation and their ASEN accreditation. That's extremely important. You can't just go to any regular nursing college. They have to have these accreditations. You also want to look at the NCLEX pass rate of the college. Is the college passing, just 70% of their students? Or are 70% of the students graduating from the college passing the NCLEX? Or is it 90% of the students graduating from college passing the NCLEX? Like, what's going on? The NCLEX pass rate of the college will show you how good the curriculum is at that college. And you want a good curriculum. You want to pass the NCLEX on the first try. You don't want to try, because the NCLEX, taking the NCLEX and setting up for that, that's expensive. As expensive stuff. And so you don't want to have to take it multiple times. You want to have good curriculum at your college. So you want to know the NCLEX pass rate at the college. So while in high school, some tips. Practice managing your time effectively. Your opportunities at TOPS are immense. I know that some teachers at TOPS, they allow you to resubmit assignments. They allow you to turn assignments late and still get full credit. In college, that's not how that works anymore. And so, you have such opportunity at TOPS to make mistakes, but not have your grades suffer for it right now. And so, you know, now is the time to practice managing your time effectively without severe consequences. Practice managing your time effectively. It's hard to manage your time effectively. I understand. I was in that position as well. Become involved and actively participate in high school healthcare clubs, associations, and meetings. I know you're all listening right now are in HOSA, which is great. That's great to be in that kind of position. Meet with healthcare family members, neighbors, or friends that can provide you more insight into different professions. Ask people in healthcare questions about why they went to healthcare, what they experience on a daily basis, what they love about it, what do they hate about it. These are important while you're in high school. You want to make sure you make, a good decision about what profession you're getting into. Thankfully, with nursing, if you don't like one aspect of it, you can go into another. It's so flexible. Even with other healthcare professions, there's different things you can get into as well. So ask. Just ask. Don't be afraid to ask. You're not going to offend anyone. I can assure you when these people were your age, you know, they ask questions. They want to know what kind of professions they're getting into. So just ask questions. I know Christine May is currently in this meeting. She's a great resource. She's a RN. She's a RN. She's a nurse. She has a nursing degree and a license. A great resource for you to talk to, and she's incredibly smart and knows a lot about the profession, so please talk with her. And again, always be curious. While in college, meet with your college advisors regularly regarding your goals and plans because they're going to help you make your degree plans and make it to where it works for your schedule. And again, pick a manageable schedule. Don't take all easy classes in your first semester and then take a bunch of hard classes your second semester. You want to mix that up. Take hard classes with easy classes. Sometimes you may start taking, 4 to 5 different college classes in your first, second semester, and those are just your like starting classes. But by the time you reach maybe third or fourth semester in college, you may be taking only 3 classes because the classes you're taking are so hard and science focused. So, so that's important to know. Limit the number of working hours if possible. I know some of you're working to pay for your college degrees. I understand. Try not to overwork though, because you want to have enough hours to study and complete assignments. And be flexible while you're in college. A plan may not go as you want it. Be flexible, but work with your professors, work with your classmates. Make time. When you're in college, again, healthcare professions are incredibly competitive, unfortunately. And so, um, you need to make good grades while you're in college. You don't want to make a B in an easy class. By easy classes, I mean like English and your histories and your government classes. You need to get mostly A's in your college classes to be successful. And so again, that's where you're working with your advisor to make sure you have a manageable schedule. Yeah. Research your professors before selecting a class. Some professors make or break a class. Some professors are hard to work with, some are easy to work with, so please research your professors. Rate My Professor is a good resource to use. Another good resource to use is some of your if you have any older friends, if they're going to a college that you went to and they had professors that you took. You want to ask them about their professors. Also, if you really want to know, go into your college university classes, figure out when, let's say, for example, the anatomy physiology lecture is taking place in a college, and wait for the students to walk out of that class and ask them about the professor, ask them about the class. So there's different things you can do to figure it out. So, of course, this is a recording. I can't answer any questions. Here's the reference slide. It's been a pleasure to talk with you today. I hope I've been able to give you some information and answer some of your questions. Healthcare profession is extremely competitive, hard to get into, but very rewarding as a profession. I hope whether you're becoming a dental hygienist, a nurse, a dentist, a doctor, a physical therapist, occupational therapist, PCT, CNA, LVN, whatever health profession you're going to go into, you're going to be valued, you're going to be rewarded, and you're going to contribute to people's health, which is very important. So I hope you enjoy this presentation. Thank you so much.